An enema can be used to treat constipation or to prepare the bowel for certain procedures. Before you administer an enema, introduce yourself to the patient. Note the patient's name, the type of enema ordered, and the time of administration. Compare the record against the label on the enema solution or package. If the enema is medicated, check the accuracy and completeness of the medication administration record against the healthcare provider's order. Then identify the patient using 2 identifiers.
All right, if you could state your name for me, please.
Joanna Hankins.
And your birthday.
7470.
Okay, I'm going to close the curtain for privacy for us.
Provide privacy by drawing the bedside curtain or closing the door. Raise the bed to a comfortable working height. Ensure that the side rail on her left side is raised.
Then I'd like to assist you on your left side, please, okay?
Help her into the left side lying or Sims position with her right knee flexed. Explain to her that she'll need to stay in this position until the procedure is complete. Cover her with a bath blanket, making sure that only the anal area is exposed. Next, apply clean gloves. Place a bedpan or bedside commode in an easily accessible position. If the patient will be using the toilet to expel the contents of the enema, make sure the bathroom remains unoccupied and keep the patient's slippers and robe handy. To administer a pre-packaged, disposable enema, remove the plastic cap. If necessary, apply a little more water-soluble gel to the pre-lubricated tip. Ensure that there is a waterproof pad absorbent side up, under the patient's hips and buttocks. Now, separate the buttocks and inspect the perianal area for abnormalities, such as hemorrhoids, anal fissures, and rectal prolapse. Gently separate the patient's buttocks and locate the anus. Help her relax by coaching her to breathe slowly in and out through her mouth. After expelling any air from the enema container, gently insert the lubricated tip into the anal canal, angling it toward the umbilicus. Adjust the insertion depth based on the patient's age. In any patient, don't force the tip if you feel resistance. Stop the procedure and notify the healthcare provider. Once you've inserted the lubricated tip to the proper depth, roll the plastic bottle from the bottom to the tip until all the solution has been instilled into the patient's rectum and colon. When you're finished, press a few layers of toilet tissue around the rectal tube at the anus and gently withdraw the tube and tip. Discard the enema container in the proper receptacle. Instruct the patient to retain the solution until she has the urge to defecate, which usually occurs in 2 to 5 minutes. To administer an enema using an enema bag, fill the bag with warm water from the faucet as prescribed. If saline has been ordered, warm the container of saline in a basin of water before you add it to the water in the enema bag. Then check the temperature of the solution by pouring a few drops on your wrist. The water should be warm but not hot. If a soap Suds enema has been ordered, add Castile soap after the water is placed in the enema bag. Next, raise the bag, release the clamp, and let the solution flow just until it fills the tubing to push the air out of it. Then reclamp the tubing. When the enema and the patient have been prepared, you may apply a little more water-soluble gel to the pre-lubricated tip. Then gently separate the patient's buttocks and locate the anus. You can help him relax by reminding him to take deep, slow breaths through his mouth.
Can you take a few deep, slow breaths through your mouth?
Touch the skin next to the patient's anus with the tip of the rectal tube. Then gradually insert it into the anal canal, angling it toward the patient's umbilicus. As you would for a pre-packaged enema, adjust the insertion depth based on the patient's age, but don't force it. As you hold the tube in place, open the regulating clamp and allow the solution to enter. Keep the enema container at the level of the patient's hips to prevent the solution from flowing out of the bag too quickly. Gradually raise the container above the anus. For a high enema, raise it 12 to 18 inches, or 30 to 45 centimeters. For a regular enema, raise it 12 inches, or about 30 centimeters. And for a low enema, raise it 3 inches, or 7.5 centimeters. Once the flow of the fluid has been established, you may hang the enema bag from an IV pole. If the patient has cramping, or if fluid escapes around the rectal tube, lower the container or close the clamp. When all the solution has been instilled, clamp the tube. Tell your patient that you've completed the procedure. Place toilet tissue around the tube at the anus and gently withdraw the rectal tube and tip. For either type of enema, explain that mild bloating and abdominal cramping afterward is normal. Ask her to retain the solution for as long as possible while lying on her side in bed. Stay at the bedside. And when the patient is ready, help her onto the commode or bedpan, or accompany her to the bathroom. Observe the characteristics of the stool and solution. Remind the patient not to flush the toilet before you've had a chance to inspect the character of her stool. If the patient needs your help washing her anal area with soap and water, remember to wear gloves. Next, remove and discard your gloves and perform hand hygiene. Assess the patient's abdomen for distension. If she was given the enema to relieve constipation, ask her if her symptoms have subsided. Help the patient into a comfortable position and show her how to summon assistance. As part of your follow-up care, record the type and volume of enema given, the time of administration, the characteristics of the resulting stool, and the patient's tolerance of the procedure.